With the 22nd pick in the 2021 NFL Draft, the Tennessee Titans select Caleb Farley, defensive back, Virginia Tech.
All right, here we go. We're talking about Caleb Farley, Virginia Tech quarterback, drafted by the Tennessee Titans. As you guys know, he's had some spine or back issues. I'm a spine surgeon, so we're going to talk about his back. So there's not really much about exactly what his injuries were, but it sounds like he had a disc herniation a couple years ago that was operated on, and I think that was at the L4-5 level. Some here, they're saying L5, but that's not the way you talk about discs. You talk about the discs in between each of the vertebral bodies, and they're numbered that way. So in the lumbar spine, as you can see here, there are 5 lumbar vertebrae. Some people might have one extra, but usually 5 lumbar vertebrae, and then you have the sacrum. The way they're numbered are L1 for lumbar, L2, L3, L4, L5, and then sacrum, which is a bunch of fused vertebrae. That top one, you call it S1, right? So this top disc is called the L1-2 disc because it's between the L1 vertebral body and the L2 vertebral body. So in Caleb's injury, which I think the first one was at L4-5 between the 4th and 5th, very common place to get a disc herniation, that's called the L4-5 disc, right? So
why is it more common to get a disc herniation there?
the reason well, let me go back and talk about the discs. Okay, so the disc is a, kind of think of it as a shock absorber. It's kind of a simple way of thinking about it. It's more than that. It's part of the joint. The spine is a series of joints, and that's one joint in the spine. There are 2 other ones in the back that we're not going to go into right now. Okay, so the disc is kind of kidney bean shaped. Okay, you can see it right here. The outside is this really fibrous ring called the annulus. Inside is the nucleus pulposus. When we're younger, it's nice and gooey and so forth. As we get older, it becomes a little stiffer, kind of like a crab meat kind of consistency. But anyway, the disc is kind of like a jelly donut. The back of that jelly donut, or that jelly donut shaped like a kidney bean, has a couple of weak spots right in the back. And those are sort of where that disc is spot welded. Because as we develop, we kind of develop into a tube that gets welded together. So there's a weak spot in everybody, the back, and that's where you have most disc herniations. They're called posterior lateral disc herniations. Some people happens more than, some people are more prone to it than others, just because they may have connective tissue issues. But then also it can happen because of the activity, right? So if you squeeze a jelly donut or one of those pieces of chewing gum, what do they call those chewing gums that have the little, anyway, if you squeeze that jelly donut, there's a hole in it, that jelly will squirt out. That's called a disc herniation, okay? If that jelly touches the nerve that is coming past that, from the spinal cord, passing by that disc through this window called the foramen, okay? If that jelly is touching that nerve as it's coming out and on its way to that foramen, it's going to irritate that nerve. One, just because the chemical nature of that jelly, also because of pressure, right? So it'll cause pain. Tiger Woods had this. Remember we talked about Tiger Woods a couple of years ago. He had 3 surgeries before he had a fusion. Then he went back and won the Masters. Anyway, so sounds like Caleb had a disc herniation, and he had a microdiscectomy to get rid of that little fragment of disc that was pushing on that nerve, causing him pain, and it can cause weakness if it's pushing on the nerve for too long, right? And then he had another surgery this year for a disc at L5-S1, I assume, because there's not really much information exactly what was done, but I assume that's probably what happened. An L5-S1 disc herniation at this level. The reason that you get disc herniations more at these levels, especially at L5-S1, in addition to the forces down on the spine, the orientation L5-S1 is kind of pointed downwards. You have shear forces as well, right? You see disc herniations usually at those 2 bottom levels. Now, does that end a person's career? No. I mean, there's lots of people who have disc herniations and do fine and continue playing, but there's always a risk of that disc reherniating. In any person I operate on, I tell them there's about a 10% risk of a reherniation of a disc. I also tell them that disc is degenerative, so it's not normal, and they may have issues later in life, They may not. Can't really predict those people. If it's a huge disc herniation and you take out a lot of that disc and there's not much of a shock absorber left in between those vertebral bodies, that person's probably coming back, to have a fusion or something like that. Will that affect their ability to participate in things? No, not if it goes well and they fuse well and they can continue. But after a fusion, most people can't get back to being 100% where they were. But again, these athletes are something special. Tiger Woods came back and played and won again after he'd had 3 surgeries to deal with disc herniations, and then finally had a fusion. And he came back and won, got the green jacket again. So it's possible. Now, Caleb, he's been drafted by the Titans. He's a cornerback. You got to worry about, any team's going to worry about injuries happening to a player. I didn't realize this, but the real risk to him is quarterbacks, which I actually thought I thought linebackers would be the players that have the most risk of a concussion. It's actually cornerbacks. The NFL did a study and saw that cornerbacks are actually more likely to get concussions than linebackers. Cornerbacks, then wide receivers, then linebackers. Counterintuitive, but that's what the data shows. You got to go with the data. Now, is he going to have issues with his back? Who knows? He's a tough guy. He's a badass. And I don't know. He might play that position well if he's the guy who's covering the wide receiver and he's just trying to prevent that guy from getting that reception, and he's not doing all the hitting. He may be okay. Remember, Deion Sanders didn't really like to hit people, and he was outstanding. I'm not saying Caleb is Deion Sanders. Nobody's Showtime, but he might be fine. So let's see how he does. I think he's going to do fine. The question is how will he hold up with those the injuries? And I think didn't he have an ACL injury or something like that while he was in college as well? Football's a great game, but man, it's tough on the body. Love to watch it, but I feel sorry for what these guys put their bodies through. That being said, they love it. It's a great game. We love to watch it. Keeps me in business.